So, IVF, it's a big deal, kind of a life-changing decision for a lot of people, and there's a ton of information out there about it. We're going to try to cut through all that and give you the information you really need in this deep dive, going way beyond just the basics.
Right, because just knowing what the letters stand for isn't really enough to, make such a big decision.
Exactly. And that's why we're lucky enough to have an expert with us today to break it all down. We'll be digging into some really interesting stuff from the Pacific Fertility Center, getting into the nitty-gritty of IVF.
I'm happy to be here. It's exciting to see more and more people learning about IVF, seeing how far it's come.
For sure. I think a lot of people hear IVF and they sort of think, okay, that's for when you can't get pregnant. But it's actually more nuanced than that, isn't it? Like, when would you actually say, okay, IVF is the way to go?
You're right, it's definitely not the first line of treatment for everyone. Sometimes it's pretty straightforward. A common one is blocked fallopian tubes, which, believe it or not, is a pretty frequent issue. IVF can totally bypass that.
Yeah.
Then there's male factor infertility. That's where IVF often comes into. But one thing I find really fascinating is how Pacific Fertility Center is using pre-implantation genetic testing.
Oh, yeah, I've heard of that. PGT.
Right, PGT. So they can actually use that to look for specific genetic disorders in the embryos before they're even transferred.
Wow, I have to be honest, I didn't realize it was that advanced. That's incredible for couples who might be carriers of certain conditions. It gives them some reassurance.
Absolutely. It's a game changer, especially if there's a family history of a genetic condition they don't want to pass on. And for the LGBTQ plus community, it opens up so many doors for family planning. But of course, it's not without its risks.
Right, because like any medical procedure, there are always going to be some risks associated with IVF. So let's address the elephant in the room. What are those potential downsides that people should be aware of?
Well, a big one that always comes up is the chance of multiple births.
Yeah, twins or more. Exciting for some, but definitely higher risk, right?
Exactly. It's riskier for both the mother and the babies. But this is where Pacific Fertility Center is really proactive. They're huge advocates for something called elective single embryo transfer, or ESET. Basically, they recommend it to almost all their patients. And because of that, their multiple birth rate is incredibly low, less than 1% for women under 38 using ESET with their own eggs.
Wow, less than 1%. That's amazing. Okay, so they're definitely taking that risk seriously. What about other complications, though?
Another one is ovarian hyperstimulation syndrome. It's a bit of a mouthful, OHSS. Basically, the ovaries get overstimulated from the fertility meds.
Ah, because those meds are used to help produce more eggs, right?
Yeah, exactly. And sometimes the body kind of overreacts. It can be serious, OHSS, but Pacific Fertility Center is super careful about monitoring. They adjust medications, keep a close eye on everything so they catch it early if it happens.
That's reassuring. It sounds like they're on top of it. But I have to say, one of the things I've always thought about with IVF, and I bet a lot of people do, is those injections. I mean, needles aren't exactly fun for most people.
Definitely not the most enjoyable part. I'll agree with you there. But Pacific Fertility Center has really tried to minimize that whole aspect. Like, did you know they try to do most of the injections just under the skin? Subcutaneous, it's called.
Instead of like a deep muscle injection.
Right. Subcutaneous is way less uncomfortable. Every little bit helps, right?
For sure. And what about the actual medications? Are there any different options there?
Oh, yeah, absolutely. Like with progesterone, which is a big one in IVF. They give you choices, pills, suppositories, or even injections you can do yourself.
That's great that they give that flexibility, let people have some control over the process.
Exactly. It's all about making it as manageable as possible.
I like that. So we've talked about the injections and the medications, but now the egg retrieval process itself. That's got to be a little nerve-wracking for people, right? I mean, what's that actually like? Is it a big surgery?
It's really not as bad as people think.
Yeah.
At Pacific Fertility Center, they do the whole thing under anesthesia, so you're totally out.
Oh, okay, good to know. So it's not like actual surgery with incisions and stuff.
No, nothing like that. They use a really thin needle, and it's guided by ultrasound, so they can see exactly where to go to get the eggs.
Okay.
And they use gentle suction. Most of the time, the most you feel afterward is some mild cramping.
Oh, that's good. I'm sure that makes a big difference for people knowing it's not going to be this big, painful thing.
Definitely. They try to make it as easy as possible.
Speaking of making things easier, what about people who don't live near Pacific Fertility Center? Because traveling for treatment, I imagine, adds a whole other layer of, stress.
Oh, yeah, for sure. But they've got that covered, too. They do virtual consultations now, so you can have your first appointments from home wherever you are.
Really? Wow. That's amazing.
Yep. And they can even work with your regular gynecologist, like for some of the initial testing and stuff.
Oh, that's smart. So how long do most people actually have to be in San Francisco for the, I guess, main event?
Usually just 10 days to 3 weeks for the whole IVF cycle. They've really streamlined the process.
Wow, okay. That's like way shorter than I would have thought.
Yeah, it's not as disruptive as it used to be.
That's great. Okay, so one thing I've always wondered about, and I've heard other people say this too, is that they think IVF uses up all your eggs at once. Is there any truth to that?
No, that's a total myth.
Yeah.
Think about it. Every month, your body gets one egg ready for ovulation, right?
Right.
All the other eggs that we're developing, they go through this process called atresia. Basically, they just get reabsorbed by the body.
Huh. So it's like natural selection, but in your ovaries.
Exactly. What IVF medications do is they stimulate your ovaries to mature more eggs that would normally gone through atresia.
Ah, so you're not like draining a limited supply. You're rescuing eggs that would have been, I guess, discarded anyway.
Exactly. That's a great way to put it.
That makes me feel better.
Mhm.
Okay. What about frozen embryos? I hear that a lot. So what are the chances of success with those?
Good question. With frozen embryos, it really comes down to three main things. First, the quality of the embryos themselves. Pacific Fertility Center, they have a really high survival rate for frozen embryos.
Because they're just like better at freezing them.
Well, part of it is they're really picky about which embryos they freeze. Only the best of the best.
Oh, so it's quality over quantity.
Exactly. Higher quality embryos, better chances of success later. The second thing is age. Women under 37, they have almost the same success rates with frozen embryos as they do with fresh embryos.
Okay, that's good to know. And the third thing.
The health of the uterus.
Right, because even a healthy embryo needs a good place to implant and grow.
Exactly. The uterine lining needs to be healthy, no fibroids or polyps, things like that. That can make a big difference.
Okay, so you got your embryos. How do they actually get transferred?
Well, there are two main ways they do it, a controlled cycle or a natural cycle. With a controlled cycle, they use hormone medications to get the uterine lining ready.
So it's more like scheduled and predictable.
Yeah, exactly. It's often better for women who don't have regular cycles or if they need to be on a specific timeline for whatever reason.
Okay, that makes sense. What about the natural cycle?
That's where they use the body's natural hormonal changes to time the transfer. It uses less medication, so some women prefer that.
So it's about finding the right approach for each person.
Absolutely. Pacific Fertility Center will figure out what works best for you.
Great. Now let's talk about transfer day itself. That's a big moment. What's it actually like?
It's surprisingly simple, and it doesn't hurt at all. They don't even use anesthesia for the transfer.
Really?
Yeah, they just use a really thin catheter to put the embryos right into the uterus.
So no incisions or anything?
Nope, nothing like that. It's all done very gently. Usually they just have you rest for a bit afterwards, and then you can go about your day.
Wow. Modern medicine is amazing. But what about people who, for whatever reason, carrying a pregnancy just isn't an option? What are their choices?
That's where egg donation and surrogacy can really make a difference.
Tell me more about that, because I think those are two things people often don't really understand. Yeah, they can seem like really big decisions, egg donation and surrogacy. Like, how does it even work? The whole process.
Well, with egg donation, it's actually pretty straightforward. From the patient's perspective anyway. It's for women who, for whatever reason, can't use their own eggs.
So that could be like because of their age or...
Age, yeah, or maybe they have something called premature ovarian insufficiency, where their ovaries just aren't working the way they should. Or sometimes it's a genetic condition that they don't want to pass on.
Right, that makes sense.
And then, of course, there are single men who want to have biological children. Egg donation can make that possible too.
So in those cases, they would use a donor egg to create an embryo, and then that would be transferred.
Exactly. And Pacific Fertility Center, they have this whole big database of egg donors.
Oh, wow. So they handle all of that.
Yeah, they do all the screening and everything. They try to match donors with intended parents based on, like, everything, physical characteristics, ethnicity, even personality, if that's important to the parents.
Wow, that's pretty incredible. It's not just about the genetics. You're finding someone who kind of fits with your, I don't know, vision of your family.
Exactly. And then there's surrogacy. That's a whole other ballgame. Usually that's recommended when someone just can't carry a pregnancy themselves.
So that would be for medical reasons.
Yeah, maybe a health condition makes pregnancy too risky, or they've had surgeries on their uterus. Or sometimes it's for LGBTQ plus couples where both partners want to be, biologically connected to the child.
Right, like they both want to be involved in that way. So
Hmm.
with surrogacy, the surrogate's just carrying the pregnancy, but the embryo would be created with the intended parent's eggs and sperm.
Exactly. Or, donor eggs or sperm, if that's what's needed. But yeah, it's their genetic material.
Okay, that makes sense. It's a lot to take in, but it's amazing all the options that are out there now.
It really is. In Pacific Fertility Center, they have a whole team that just focuses on surrogacy, making sure everything's legal and ethical, and that everybody's on the same page.
That's good. I imagine that's super important, having that kind of support.
Absolutely. It can be a really emotional journey for everyone involved.
I bet. So it sounds like knowledge is power, really. Knowing what your options are, that's got to be the first step.
Totally. That's why I love what Pacific Fertility Center does. They're all about educating their patients, making sure they understand everything before they make any decisions.
And working with a fertility clinic you trust, that's got to be huge.
Oh, absolutely. You want to feel comfortable, like you're in good hands.
Well, I think that's a great place to wrap up. This has been so informative. I've learned a lot, even just about things I thought I already knew.
Well, I'm glad you think so. And, hopefully our listeners got a lot out of it too.
I'm sure they did. So, if you're out there thinking about IVF, don't be afraid to ask questions. Talk to a fertility specialist, find out what's possible. There's a whole world of possibilities out there, and with the right information, you can make the choices that are right for you.
Absolutely. Don't give up on your dreams.
Perfectly said. Okay, that's it for our deep dive on IVF. We'll be back next time with another topic you won't want to miss.